These are exactly 10 years since Ghana experienced one of its worst flood and fire disasters, which claimed over 150 lives. Today we ask, have lessons been learned from the bitter experiences of the past, and why are some victims yet to be compensated?
Also, the Office of the Special Prosecutor refused suggestions by lawyers of embattled former finance minister that his office was furnished with details of his medical records.
Plus, Ghana Infectious Diseases Center urges members of the public to observe safety protocols as they confirm cases of the dreaded Mpox disease has increased to 45.
You're welcome to News Central. I'm Kamini Amano.
And I am Mawina Igbeta. The bulletin starts right now.
Now, 10 years after the tragic June 3 twin disasters, we take a look back at the causes, struggles, and whether or not the country has learned its lessons. Judith Brown explains.
It's been 10 years since the twin disaster that brought Ghana to a standstill. Flood and fire, horror and heartbreak. Over 150 lives lost, dozens more injured, a city traumatized. But beyond the pain and destruction, that night showed us bravery. Strangers becoming heroes, and ordinary people risking their lives to help others. Ghana stood together on that fateful day. Well, a decade later, the question still echoes. Have we really learned anything? It happened on Wednesday, June 3, 2015. It had rained heavily that day, more than for the season. By evening, parts of Accra were submerged under floodwaters. In the heart of the city, Kwame Nkrumah Circle was one of the worst hit areas. Dozens of people sought shelter at the Gold Filling Station, hoping to wait out the rain. But unknown to many, a full leak from an underground tank was mixing with the floodwaters. And then came a spark from an unknown source. The station exploded. Flames, panic, screams, and devastation followed.
I was standing by the window there. The fire came from the left side. And another one made it. And then it drew the iron gates down there. The whole building was shaking. I thought it was collapsed.
We heard the military crying, where are you? Where are you people? And we said, we are here. So they came up and they told us that, you see, this time is between life and death.
In a matter of minutes, over 150 lives were gone. It was one of the deadliest disasters in Ghana's modern history.
A lot of people have lost their lives. I'm at a loss of words to express how I feel.
Investigations later revealed that this was a preventable tragedy. Poor drainage, choked gutters, unregulated construction on waterways, and a lack of disaster preparedness all played a role. What should have been heavy rain became a national tragedy because the system simply failed.
There are those who will wish to apportion blame, and quite truthfully, there's plenty of blame to go around. But when we list one by one the various mistakes and failings that contributed to this catastrophe, I hope it is not for the purpose of pointing fingers, but rather of making certain that something of this nature never again happens to our dear country.
In the days that followed, the nation mourned.
Ghana is in a state of mourning, but weeping does not solve problems. Positive action involves expertise.
A $15 million recovery fund was also announced, and DNA tests were ordered to identify the victims, and emergency services began desilting drains and clearing debris. For a moment, there was unity, resolve, a commitment to change. But 10 years on, the story sounds all too familiar. Just weeks ago, in May 2025, torrential rains caused major flooding in parts of Accra, especially East Legon Hills. A 5-year-old girl lost her life at Nanakrom in Adenta. Families were displaced, roads turned into rivers. The capital was once again overwhelmed. And this is not an isolated case. Let me tell you some from previous years. October 7, 2017, a gas explosion at Atomic Junction killed at least 7 people. In January 2022, a truck carrying mining explosives exploded in Bogoso, killing 13 and destroying hundreds of buildings. In March 7, 2023, floods in Accra led to the deaths of 3 people, including 2 children, and a collapsed building. For September 15, 2023, spillage from the Akosombo and Pong dams displaced over 35,000 people across the Volta and Eastern region. January 1, 2025, a fire at Kantamanto Market killed 2 people and destroyed thousands of stores. This list goes on and on. In the aftermath of the June 3 disaster, a 197-page report was commissioned by government, but it never saw the light of day until the Bureau of Public Safety, a private organization, intercepted and leaked it. That report detailed failures, the risks, and the recommendations, but it was never fully acted upon. 10 years on, the core problems persist: weak regulation, poor enforcement, and reactive rather than proactive leadership. So what must be done?
If we follow the laws, at least about 80% of it, I'm sure that we're going to have a minimization devastation that we are recording now. Now that the sea is rising, it means that your retention, or before the water from the Odo and other tributaries will enter into the sea, it will take a longer time. So it's only proper that once you know that you're going to have a longer time for the water to enter into the sea, it means that you have to create your retention ponds to be wider, be able to accommodate a certain quantity of water to minimize the extent of devastation.
It's not enough to build roads and bridges. The country needs to build resilience, because with every rainy season, we risk repeating June 3rd. And maybe the real tragedy isn't what happened back then, but that 10 years later, so little has changed. We remember the victims. We honor the heroes. But remembrance must lead to reform. Otherwise, we're just waiting for the next disaster. Judith Brown, TV3 News.
There's more on this story as we remember that terrible day 10 years ago. We'll now join Judith Brown, who's live with some relatives and victims of the June 3rd, 2015 twin disasters here in Accra, for an event to mark the 10th anniversary of the disaster. Judith Brown, talk to us. What is happening where you are?
Okay. So I'm currently here at Circle, right opposite the Vienna city. Over here, a number of victims of the June 3rd, 2015 disaster have gathered to share their concerns, and their concerns are quite simple. They're asking that government does not just see them as statistics, as has been the case over the years. They're also asking for government to compensate them. It's been 10 years since the incident happened, over 150 lives lost, yet many of those who survived the tragic incident have still not been compensated 10 years on. I'm going to be speaking to some of the victims of the tragic incident. This lady lost her husband during the incident. She's going to be telling us really what happened and how it has been after 10 years. Ma, Pacho, you're frozen.
Actually, famous stage.
Na deɛ na esi incident esi no deɛ na esi
Me pacho eye mi kun ene ka ho. Na eye June 3 no enwumbre no okoye adwuma wo eye odoko. Nti mra wo ba no me ne kasa enwumbre ni mu no awie ni mu kwa enwumbre no. Ba enwumbre ni mu be say be 9 to 10 me friend and line sa na enko. Nti me dem to pro na me ne nkwala ne dai. Ti ade chi anopa no na ye light no call off na me phone so dum yi. Nti na me hwe nkwala na mama ko school me fe me je obi lie e friend na enko. Nti me yes madwen se sa na tie dia me hwe anim kakra ma na ba. Nti me ho man na ne wo fa bai say wa free line sa enko. Yenso de na esi wo kwa me nkoma second ni ye nti hwe. Nti ne nua ne bra de bai no ne wo fa no na wo ka che me say me enko cycle na yenko na adwuma mu onko. Na adwuma mu so wo Iran clinic opposite wo ye carpenter. Nti tama ye call ye no ye du ho no na de esi wo kwa me nkoma cycle na nya asem papa. Ti ye du ho na eye ne master ba kubusa ye say na ukun agye wo hefa. Na me say agye woni adwuma mu ha nyame ni atwanse wo na no na awosin bi agume. Na ye sesa na tie de a nti ni nua ba ko ye police ni ye friend no ka che ye say ye de ye nkofie na obehwe no. Na me say da bi me hu me kun a me ntumi ye de entena. Me so me ne wo ma me yensa. Kiti wo mu no no onya 1.5 year na me say da bi mehwe no. Nti wo mu ye say ye nko police 37 ti ye ko 37 first ye ko anyankopo anim ni na ehu den
hu no ho
me ko ho me hu no. Nti police hospital ene ye ko nso ye hu nti mo kire ho na me ne wo fa no ne ye ko nti ye du ho na me hu say body no da ho nyame anim ni na ani enyan by nyankopon ma makokuduro ma mitimi fi ho ba mi fi ho atwanse ho no me hu bi hwi biem na yede nyankopon adom yede eye bibia me yede ne hyem a time ne so ye no yede yi no ne ekosie no.
Nti say 10 years aba government ama bibia na mo provide bibia ma mo say wo enkola miensa na.
Me pa cho government ma me bibia say de omode ma ye no ye abusuafo de na omode ma omo say omo mfansie ade hye no ba ye yan abata na yekuta nkola no omo aban ma ye hwe. Nti be 10 years ni akola no o kitwa no a no wo mu no 1.5 year nyankopɔ no sisi nyankopɔ wo wan kakra ama sisi no akola na nya 12 years.
Nti sisi ade na mo pay free government nchen.
Nti de besre ye papa president say yesre na abatan a yekunum ene ye yerenum efiri mu no yesre no omoye onkoye mo sisi adu ba bia nkwala no mo anyinyina eduru no afei mom na sika de behwe nkwala no secondary school ene university no afei na eduru ho sisi aso mo school sam no lolo ayi no emu apagya. Nti yesre na omeboa yen wo nkwala no school hwemu na yenti mi ma ye ma no nso nyina baabi se de wo papa te ase a ankomo de nkwala no ebegyina baabi amaye no. Nti wo moa yen na ontimi ma ye ma no so empagya enkoso na omo so nya adwuma bi no omonye sisi afia me ka say me baba akwo ka omo twero DCA ye ho no obekọ secondary school sisi no mani at time me hu baabi a me konya emmoa afi ti esrai papa president na aboafo say omeboa yen a yekunum ewu ye no ene praye no omeboa yen.
Yeah, that's it. So this is a mother of 3, Patrobetumiako. This is a mother of 3 who lost her husband during the tragic fire, the twin incident, twin disaster, flood and fire. Her husband was lost during this incident. She's calling on government to help them with some compensation to be able to take care of their children. There are some more victims here, and I'm being joined by a gentleman who seems to have a bit of scars. You can see from his neckline through to his arms. He definitely was part of those who were immediately affected by that disaster. Pacho, you're saying? Now, during disaster, the DNC, me who say who like what she kakra DNC.
Me to ade kanta na me ko kanta manto. Me ne pabo ekọ. Ti me duru na me wura mo no supermarket no. Me to ade na me hu say nso no aba mo. Nti me breki kakra nti afei no na eba mo nti nso no wugina ma ene fuwe ne no diesel no amix nti wugina ma na body na wo nsuo no na hyehyɛw na fuwe na amix nsuo no na diesel no so tani To be Jahana, fire no, tender and fire never told in sooning. And Tina said, the Asian, which Jan soon more now, Okomo, Wanima, and soon a Chuaco. And now, which Jams were a dance or so. To be a senator, giant, a do and die. And to be found soon, many Janis are to be a Janinian. Tijuana might be pajama, 20 came, and they call 37. 37 or the China President Mahama Bano say, or for hospital be a hospital or full be a hoka. And to hospital and Chiache, and to China, or yes, will be Chess Cabidi Amay, compensation, we know the Amay. The flu on, you would start here, conversation, and Yansan Cafe, or Honey we afro, any Mosca, or Honey afro, any some medicine.
It's when Nashe cry. Even Sika would back Ebe Hili when Nashe.
President Chia Naka Hospital, and to Honda Hospital, the man Chia by me coffee near there. Me, I'm more than one. I may, I do see.
Now, business and so say, Anna.
Patch I come a captain in us. I lost way. Say in Pabua, and the next council morning. Into pay free government. Me, young government in the more. So, boy, near your captain, so they started business. As I didn't be out of Coco bag, and if you wouldn't pound crown or send a crana, who are crowd so the Silensia, and open a biafra, or bet you ask us 1 month until young government more. So, boy.
Thank you very much, Inti. So this is a young man who was affected, as I said, by the fire. He used to sell clothing and shoes at Kantamanto. He says that his business was destroyed. He was burnt as well. But although government covered the entire cost of his medical bills, he did not receive any other compensation in terms of his business and livelihood afterwards. And so these are some of the stories that we've heard right here from Serco opposite Vienna City, where victims, as I said earlier, have gathered calling on government for compensation. As you can see behind me, they're having a meal after they had their presser earlier this morning. But this is what really is happening. They're asking government to compensate them and help them, go through life moving forward. It's been 10 years and it's not been easy for most of them. Reporting right here from Serco, my name is Judith Brown.
And it's still NewsCentral here on TV3. Thank you so much, Judith, for that report. We'll get onto the phone lines now and speak with development planner Alfred Opoku. Alfred, good afternoon to you. Surprising that 10 years on, victims still talk about compensation, right?
The 10 years is too long and compensation should have been paid. But the important thing is that have we learned anything that will prevent this compensation to be raised at all? Unfortunately, the June 3rd thing was such that it got mixed up with fuel. The storm drain got mixed up with fuel and caught fire and all that. We haven't had that extent again, but we still have flooding and the loss of properties, fatalities and all that. The key thing is that have we learned anything out of it at all?
What would you say?
We do not get into that situation again.
What would be your response to that question, Alfred? Have we learned any lessons yet?
Well, we learned of the causes of the disaster, and whether we are working on it to prevent it is a different thing. So it's a difference of learning to know the problem that brought it, and another thing of working on it to solve the problem. For example, among the things we saw was that the misuse of drains, where it has become, uncovered drains have become a passage for domestic waste. You know, earlier, immediately after the storm, that disaster, a few people were arrested. They were caught red-handed pouring domestic waste into the drain. And I remember somebody was even arrested at the motorway when he threw out something from his car. Apart from these two incidents, we haven't had anything at all. So pouring domestic waste into a drain has become a norm in Ghana, unfortunately. Up to now, people still do. The other thing we saw as a cause was that all the assemblies, especially those within the Odo River corridor, they do not work together. There's no coordination among them. Assembly A, the drain has drainage up to 1 kilometer, and Assembly B should continue from there. He doesn't do it.
So whoever has done his own doesn't save anything at all. So that was a problem of uncoordination among the planning and implementation of work among the assemblies.
Well, Alfred, is that to say that we are not putting the resources in the right places to be able to tackle the perennial floods in the country?
We are not enforcing what should be done. But as for resources, you would need them, but if you do not encourage the right thing to be done. For example, there's a Gary project that gives money to the assemblies, a certain amount of money, about 300,000 or 400,000 a year. But we're expecting all the assemblies to come together, prepare one plan, and get one budget. Instead of giving the money to individual assemblies, get the money together into one envelope and prepare one budget and let them use it. So
Indeed, Alfred, I'm afraid we're out of time. We'll have to leave it here. Thank you so much for talking to us. Alfred Poku is a development planner.
Staying or going next to a different subject, because this afternoon there is a global manhunt for former Finance Minister Ken Ofori-Atta, who has once again been declared wanted by the Office of the Special Prosecutor. The Special Prosecutor, Kise Jabe, at a news conference yesterday announced the re-entry of Mr. Ofori-Atta onto the list of wanted persons after Ofori-Atta failed to attend an in-person invitation to answer questions in 5 concurrent criminal investigations. According to Mr. Jabe, the former finance minister's absence on the grounds of ill health cannot only be proven, but also an act of bad faith that will no longer be countenanced.
Declares that Mr. Ofori-Atta is a wanted person and a fugitive from justice. His name is hereby re-entered on the OSP's list of wanted persons. The OSP will take all necessary legal steps to secure Mr. Ofori-Atta's return to the jurisdiction and to answer to the criminal inquiries against him. In pursuance of this, about 30 minutes before this briefing, I triggered processes for the issuance of an Interpol red notice for the location and provisional arrest of Mr. Kenneth Nanaya Ofori-Atta in whichever jurisdiction pending extradition or his surrender. Around the same time, I dispatched a request for extradition processes to be instituted for the provisional apprehension in any jurisdiction in which Mr. Ofori-Atta may be located or found, and his extradition to the Republic of Ghana. From 20 to 21 March, when he said he was going to have the possible medical intervention, surgical intervention, upon which reckoning we indulgently said, oh, take some of the days, recuperate. So he suggested he will come between 14 to 30 May. We said, oh, take a few more days, come on 2nd June. How friendly can we be beyond this? After accommodating you, you sat by for at least 67 days when you knew your condition had changed, and you never bothered to tell the OSP that there's been a fundamental change in your condition. You're acting in bad faith, utter bad faith, and for which reason we have stopped this party. OSP will prefer criminal charges in the courts against Mr. Ofori-Atta in due course, whether in absentia or otherwise. The principle upon which we proceed is that no person, regardless of title, regardless of status, regardless of medical condition, is beyond the reach of inquiry by the OSP.
Well, those who are raising concerns about that extradition efforts and how successful the OSP can be. Let's get onto the phone lines right now. Speak to Christian Mamhese. He's a private legal practitioner on what he makes of this. Counsel, I appreciate you joining us. We have a fair understanding of what this Interpol Red Alert is, but provide us with a bit more on that, and then the efforts to have Ms. Ofori-Atta extradited into the country. Many say that could face serious challenges.
Thank you for having me, and regards to your viewers and listeners alike. In the laws of extradition, we say the procedures remain very simple, but the practice of it is very, very complicated. Now, this is it. When a country seeks to extradite its citizen based upon a crime committed,
first and foremost, you need to put in a request. Whenever you put the person on Interpol Red Alert, you put in a request to the host country where the suspect is residing or domiciled. Now, after that, you furnish the host country with the legal evidence. So that's the charges and all of that. The reason why you think and believe that the country should extradite a particular person. It should align with the extradition laws of both Ghana, UK, and US, because the OSP said that he might be in US or UK. Now, aside the laws, it also goes to the treaty executed between these countries. Having said that, it goes to say that having served these countries with the charges, we now ascertain whether they form part of the extradition offense or extradition crime listed in the schedule thereof. When that is done,
right,
and it is served on the other country, it is now for the country to see how to extradite this person. Now, that is where it becomes complex, because the suspect could put in an application to the court, because a court must ascertain whether the extradition process is allowable.
Right.
One needs to understand that when it comes to extradition processes, political issues in nature is an exception. So when that particular person puts in an application, now the court would have to go into it, and it becomes a whole prosecutorial and defense matter. Because, like I always say in jurisprudence, every duty comes with a right. So just as a state institution is conferred with a right in jurisprudence,
right,
there is a corresponding right to be upheld. And that right rests with Mr. Ofori-Atta.
Right.
So he would exercise his right in the UK court as to whether the UK should allow him to be extradited to Ghana.
Counsel, you mentioned UK. Is it that you have word that he's left the United States to the UK, and that's the first? And then from what you're telling us, it does appear this is not going to be as straightforward as may have been suggested in any way or form by the special prosecutor when he says they are going to take all necessary steps to have him return into the country to answer these questions.
Yes, I mean, it is very, very simplistic. The OSP suggestion is too simplistic, like I told you. In the laws of extradition, the first thing that will be told to you in that legal class is that it sounds simple, but in practice, it is the most complex situation, because it's going to be a battle. And when the host country comes to a conclusion that that person cannot be extradited, there's little that the requesting country can do about it. So yes, it's one thing that we'll put in the request, and just like the OSP said, he has triggered the processes and all of that. It is the simplest part to do, but the complex aspects await him as to how Mr. Ofori-Atta would come to Ghana would remain a legal battle. So it is not simplistic at all. We have a lot of hurdles to cross before Mr. Ofori-Atta would indeed get to the shores of Ghana.
Right, but there's the other argument on the part of Mr. Ofori-Atta as well. This continuous description of his person as a wanted person and a person running away from justice does not serve his purpose. There's an Interpol red notice, which means that he cannot freely travel. What would you advise if you were his counsel as to processes he can take? Because yes, it may be difficult to have him extradited into the country, but obviously it will not be so easy to have him move around and freely in seeking this medical treatment as he may want.
Like I told you, UK is one of the countries that are very interested in extraditing a suspect. So they love to interrogate the rights of the person. Now, if you look at a country like India, they have over 6,000 requests for extradition of suspects. it's only 1/3 of that has been successful. So it is not an automatic trigger that once you say this person is in UK, I want it. But US is more friendly. So it is going to be a legal battle. Because you would also put in a legal challenge to say it is for whatever. So there is a balance of rights. And at the end of the day, the court in UK would have to decide. That is, if Mr. Ofori-Atta wants to challenge the extradition process. If he's unwilling to challenge the extradition process, then it ends there. He just be brought. Then there will be a surrender as we have it under the extradition law, and that would come. But if he intends to mount a challenge, then the OSP's statement is merely simplistic, but it is a legal complexity that he can never overlook.
Counsel, I asked this question. It looked like you didn't answer me. You've been very direct on what the UK's processes are. Is it that you have it on good word that the former finance minister is now in the UK?
Away. Your line is fading away.
No, I was asking that you've been, in all of this explanation, been heavy on what the UK's requirement is. I'm just asking that if you have on good word that the former finance minister is in the UK as we speak.
No, I do not know. I'm only citing the legal dispensations of both countries. That with UK, they are suspect oriented. They are suspect interested because, I mean, to extradite someone, they want to ascertain the legal rights of the person. So with UK, it is more complex than in the US. And I'll just run in by you the number of triggered cases just with India. Over 6,000 cases, they have only been successful with 1/3 of it. So it tells you that the UK courts are interested in looking and hearing or to understand unless it is legitimate. Now, one of the processes, one of the issues with Mr. Ofori-Atta is health issues. Is it that he's unwilling to provide or share or disclose his confidential health issues with the OSC because from all intents and purposes, there's no trust relationship between the two. But will he be willing to show that to the courts in UK, or will he be willing to show that in the US? It is going to be a legal battle.
I appreciate you speaking to us, Counsel.
But it is more complex than it is.
I appreciate you speaking to us. That's Christian Mamhezi. He's a private legal practitioner helping us understand what really the challenges could be possibly for the special prosecutor and his attempt to have the former finance minister return to the country. There's another leg of this conversation which we're staying on, which has to do with latest circulation of a letter by the hospital Ms. Ofori-Atta is receiving treatment at. That letter has been making rounds detailing the medical condition of the former finance minister. I want to take you through a quick response that's been coming through from the Office of the Special Prosecutor because they've been reacting to that letter, purported letter circulating on social media. They've had cause to respond to it directly. What exactly have they been saying? Let's take you through that right now. And we're going to do that verbatim because it's very important that we establish the basis and the arguments the Office of the Special Prosecutor is making. They say they've become aware of a publication online, on online media, purporting to be a letter from a hospital containing alleged medical report on Mr. Kenneth Ofori-Atta. The OSP says they wish to place on record that neither Mr. Ofori-Atta nor his lawyers have submitted any such letter to the OSP. Now, they say that the only correspondence they've received from his legal reps is a letter notifying them of a change in his medical condition and on their say-so. And he adds that, or the office adds that it is notable that this alleged hospital letter has been circulated through the media rather than submitted to the law enforcement agency actively investigating him and responsible for decisions regarding his return to Ghana. The last part. To date, the OSP says no certified medical records or official document from any hospital authority has been submitted to the OSP indicating that Mr. Ofori-Atta is incapacitated or unable to travel. And so that's the latest from the Office of the Special Prosecutor, saying that, yes, they've cited the purported letter from the hospital, one which we're not going to name, but they, amongst many things, say that they have at no point in time received any correspondence from any hospital detailing these conditions as captured in this purported letter. We are waiting to see, really, what becomes of all of this in the coming days.
In the meantime, this afternoon, President John Dramani Mahama is receiving the Association of Ghanaian Exporters as he readies himself to set in motion the implementation of his flagship 24-hour economy. Now, the meeting is expected to seek opinions from the association in the quest of government's efforts at improving its export drive in the wake of the cedi's appreciation. Let's take a listen to the president.
The recent appreciation in the value of the cedi is one that we have kept watching. As the cedi started to strengthen and the dollar depreciated, with our A-level economics, we all know that it's a balance between imports and exports. What it means is that it makes your imports cheaper and your exports more expensive. And so there must be a fair balance to try and achieve the true value of the cedi. Some people say, oh, it will come down to 4. But of course, we know the true value of the cedi is not 4. And if it went as far down as 4, it will kill all your export businesses. And so myself, the governor, and the finance minister met and discussed it. And they think that the real value of the cedi is anywhere between 10 and 12. Luckily, the Forex auction has brought it to just above 10, and it appears to have stabilized there. So I think that going forward, anything between 10, 11, and 12 as a band where the cedi operates will be a fair value, both to encourage our exports, but at the same time not make imports so cheap that importers will flood our markets with toothpicks and, biscuits and coconut and all those kinds of things. And so it's a challenge to our exporters to take advantage of the cedi's appreciation, because then the advantage you also have is raw materials can be cheaper. Fuel has gone down, so transporting your products and all that will be cheaper. Port charges will go down. And so it has incentives for you. And at the same time, it has incentives for importers. But I'm asking the importers not to take advantage of it and flood us with all the, Nkatia burger and things that they bring from other countries. Let's try on the import side to import substitutes and produce as many of the products that we bring from outside. Let's produce them here. And at the same time, let's produce more products that people demand outside so that we have a better balance in terms of our economic growth. And so, like I said, it's both, it's an advantage for us, and we must take the opportunity. So I was happy when our speaker spoke about how you intend to take advantage of the improved economic environment. We must improve our export processes so that it makes it easier for you to be able to move your export products out.
President of the Republic, John Dramani Mahama. You're so live here on NewsCentral. When we come back, we'll talk about Mpox, because the increasing number of cases is raising concerns among a section of the public over public safety. We'll talk about it when we return. Don't go away.
Why are more and more professionals
Still News Central here on TV3. I'm Kemini Amano. Now, the recent increase in the number of confirmed Mpox cases is largely due to enhanced surveillance efforts, particularly through active contact tracing and a heightened level of awareness among the public. Now, that's according to officials of the Ghana Infectious Disease Center and Mpox case management team. These efforts, according to the center, are crucial in the strategy to identify and isolate cases promptly in communities. Now, the Ghana Health Service has so far confirmed 26 new cases of Mpox, bringing the total number of infections across the country to 45. The center is therefore urging people to adhere to public safety rules, public health safety rules, including maintaining good personal hygiene, visiting the nearest health facility when you develop any of the symptoms. Let's have a quick chat on the back of this. We can now talk to Director of the Ghana Infectious Disease Center and Mpox Case Management Lead, Dr. Joseph Oliver Kome. Doc, good afternoon to you. Looks like the preventive measures are not working as well as we would want it to be. The case count keeps going up.
Good afternoon. I struggle to understand why you feel that the prevention measures are not going up. In fact, we are happy that the numbers are going up. It's better you find the cases rather than not find the cases. They let them hiding, and then it blows up in your face. So for us, we know that the numbers will go up, and then once we know we have covered enough ground, we will see that the numbers are plateauing again. So yes, you may not, as the general public, enjoy the fact that the numbers are going up. But for the numbers going up for us as the health workers, we are excited because then we are looking for the cases and we are finding them.
In other words, we should expect to hear more confirmed cases because you're tracing and surveilling the movement of the virus.
Yes, you should expect to see more cases. And that is what is expected. Once you are looking for something, you will find it.
I see. But how do you respond to a section of the public who have expressed fear because the numbers are going up? What would you say to them?
Well, the people are already in the community. The people are already there. It's just a question of we looking for them and finding them. So the populace should not be too worried. The good thing about Mpox is that with all these cases suspected and confirmed, at least there has been no mortality. We currently have just about 2 patients on admission. And I keep on saying they are on admission not because they are sick, but because they cannot do home isolation. That's why they are in hospital isolation. So the general public should rather take care of themselves. Think about the other person. Once you have a rash, cover that particular rash and seek medical help. In that case, that rash doesn't come into contact with another person who might not have it.
Any kind of rash at all?
Once we are protecting ourselves, the numbers will come down and then we shall all be happy.
Now, because you talked about a rash, I'm inclined to ask if it's any kind of rash at all or perhaps a particular type.
So when it comes to Mpox, the rash starts like a very flat rash and later progresses to be one that is filled with fluid. So in this time and season, every rash we don't understand, we investigate. So I will say that once you have a rash, you don't say that after this rash, I've had it before, so I know what it is. You seek help, and then we can help you.
I see. Now, where are we seeing the most cases across the country?
Well, at the moment, 2 regions are reporting a lot of cases, or most of the cases, being Western region and the Greater Accra region.
Western and Greater Accra regions?
Yes.
How many cases are they contributing to the case count?
Well, I guess just about a total of if I should, just about 16 cases to the total count that you have.
I see. We'll leave it here. Thank you so much, Doc, for talking to us.
You're welcome.
So that's it on the subject of Mpox. You heard the doctor. If you have any rash because of the outbreak of the virus at this time, you should take it to the closest or nearest health facility. We'll now bring you by the numbers.
You're welcome to By the Numbers. 12.7%, that's the portion of young smokers in Ghana, many of them between the ages of 18 and 29 who use shisha. It means roughly a number of them are pretty much exposed to turning to water pipe tobacco with a noticeable trend among young women. On today's episode of By the Numbers, we take a close look at smoking habits in Ghana and what the numbers reveal beneath the surface. Currently, 4.8% of adults aged 18 to 69 in Ghana smoke tobacco, but that headline figure hides a significant gender gap. Let's take you to the board right now, seek to break down the numbers for you. And we're starting off with that 4.8 figure, which I mentioned to you, pretty much explaining the percentage of the population 18 to 69 years who smoke. That's 4.8%. And when you look at it on the face value, that's, I mean, if you look at the numbers, our population, it's not quite significant, but when we begin to break it down for you, then perhaps you begin to appreciate why this could be a concern and that there's a wide gap in terms of that. Now, between that, we find that when you want to compare between the males and the females, this 18 to 69 years brackets, the percentage of which age group is really engaged in this habit, you find 9.3% of them being male as against 0.3% of them being females. And so it looks like the men do it a lot more. But we'll get an interesting data about the use of shisha, and that's where you see that a lot more women prefer that. Now, when of this 4.8%, 64% plus of them smoke daily, means they are addicted and every day have to smoke at least 3 sticks of cigarettes to satisfy the cravings or the urge. Then here's where, for those of you who do not smoke, there's a bit of a concern for you. Up to 19.9% of the Ghanaian population are exposed to secondhand smoke at their respective places of work. 19.9%. And if you've heard some of the medical experts speak, this sometimes is more dangerous than the people who do the direct smoking as well. And so a cause of concern there, but let's look at the smoking prevalence by age and then gender. And so we're seeing 18 to 29 years constituting some 9.6% of the number we're talking to you about. Then there's the 30 to 44, 7.6, 9.6 again between 45 to 49%, and then the 60 to 69%, 14.5% of that number which we got to know about. On prevalence, we brought you details of that, where out of the daily smokers now, what we understand is that a majority of them are men as well. That's 64.8% we showed you in the first graphic. About the 4.8%, the number of people who can't go a day without smoking was around 64.8%. If we narrow or zero in on that number as well, a lot more men are doing the smoking. When we look at urban versus rural as well, we find out that a lot of these individuals are doing this in urban areas as against the rural areas. Now let's look at smoking patterns. And I mentioned how persons who smoke daily have to do at least 3 sticks a day, and their smoking frequency, we mentioned that to you already. But I'm trying to move you on to the consumption of cigarettes within the country. And we see that 3 sticks at least a day, hand-rolled cigarettes, that's a very tricky area, what hand-rolled cigarettes could be. But we're seeing persons smoke at least 1.2 sticks a day, and then other forms of other smoking habits, we find that. But let me bring you to this particular aspect having to do with shisha, because we've done lots of reports on that and how medical experts are raising concerns as to how that could lead to terminal illnesses and the likes. We're seeing a lot of the youthful population, unfortunately, fallen between this age bracket. And when we try and zoom in a bit more, you realize that there are a lot more women who are unfortunately preferring to smoke the shisha as compared to other forms of tobacco use as well. And so that's just it for you by the way of the numbers this afternoon. And that's all we have for you as well today.
Now, health workers, especially nurses and midwives in Ghana's deprived communities, face significant challenges from the poor infrastructure to limited resources. The situation is a contributory factor to the high attrition rate in those areas. But now, the Ashanti Regional Health Directorate is introducing a new incentive package to motivate and retain these frontline workers.
For nurses and midwives working in Ghana's deprived communities, daily challenges like poor accommodation, unreliable electricity, and inadequate health facilities make their jobs even tougher. Compared to their urban counterparts, these health workers often struggle with limited resources, affecting both healthcare delivery and their personal lives. To address these issues, the Ashanti Regional Health Directorate has introduced a non-monetary incentive package aimed at motivating health workers in underserved areas.
Almost everybody wants to stay in Kumasi. So we will have to have a way in addressing this. Other than that, we will attract more and we will not be able to let them go. If you serve for 2-3 years and you are in any of these rural areas, one, you qualify for steady leave, with or without pay. 2, you also have what enhanced promotion and upgrading, so that whilst maybe your colleagues are going to spend about 5 years, 6 years in the urban areas to get promotion, to get upgrading, to get steady leave. This non-incentivized, non-monetary incentive is only for people in the rural areas. And this is what we have prioritized as a region.
The announcement was made during the Ashanti region's celebration of International Nurses Day. Meanwhile, the Ghana Registered Nurses and Midwives Association is pushing for another major change, which is upgrading nursing colleges to degree-awarding institutions. Jones Ofori-Atta is the Ashanti Regional Chairman of the association.
Why not Ghana go the international way by making every entry, the only entry, be degree, so that when you enter as a degree, at least if there's any study leave that will be given, you'll be given study leave to specialize or study leave to do masters, and that becomes short, and then those people will be available to do the work for the service. Education decided to go degree, and it has been successful, and that improves services, because research also shows that higher education in nursing improves quality outcomes and reduces disease burdens.
With these proposed changes, health officials hope not to only improve conditions for nurses, but also strengthen healthcare delivery in Ghana's most vulnerable communities.
Ibrahim Abubakar's report. Bringing an end to this afternoon's edition of The Bulletin, I am Awena Egbeta.
And I am Kemini Amano. Thank you so much for your company. We'll see you same time tomorrow. Bye-bye.